Hi, how are you doing? Are you feeling tired? Or perhaps you have a mild headache? Do you need to see a doctor? Or maybe just take some rest? You should meet Sympthia. She has the answer. Hello, everyone. We are a team comprised of Rodrigo Alfaro, David Garcia, Emmanuel Olajubu, and Ana Quiroz. And we are here from the University of Niagara Falls, and we're glad to present to you our Sympthia system. The Sympthia system can help you know more about your symptoms, guide you to determine if you need either a visit to the ER or to schedule a doctor's appointment, or just suggest how to take care of yourself in case a visit to the doctor is not really necessary. And you might be wondering, but is it really for me? Let's look at some cases. Here's Miriam, for example. She usually waits for her symptoms to just pass. She says her body can recover by itself. But right now, she's feeling a sharp pain in her chest, and she's hoping that it will go away on its own. On the other side, here's Marcos. He goes to the emergency room anytime he can, even for a seasonal cold or if he's just feeling a bit dizzy. He says it's better to be safe than sorry. And he right now is feeling a mild headache, so he's about to head over to the doctors. These decisions could put Miriam's life at risk or overcrowd the healthcare system. So we should really start thinking a bit more about how to manage these choices. So what happened is Marcos discovered Sympthia. He now knows what to do when he's not feeling his best. He can just talk to her and she can let him know if she needs to go to the doctor's office or how to take care. And Miriam, with Sympthia's assessment, she figured out that her symptoms could become something a bit more risky. So thankfully, she got medical attention in time and she predicted a very grim future.
Now we will see Sympthia in action. When we open the app and say hi to her, we can tell her we are sick and she will ask for our symptoms and location. Based on our answers, Sympthia can determine whether we need to go to the ER, schedule an appointment with a medical provider, or just recommend something to alleviate our symptoms. In this case, as the fever is over 40 degrees Celsius, it's an emergency and Sympthia's recommendation is to go to the ER. Now let's see how the app works. Additionally, while Sympthia is helpful to the end user, the symptoms and location given provide useful information with a lot of potential insights. Sympthia gathers useful real-time data to identify possible infection sources, predict spreading diseases, and more. The potential of this tool is huge. With the help of Google's Looker Studio, Sympthia feeds the dashboard, as this is a Canadian-developed software. Our example data is located in Canada. The dashboard allows the viewer to know how many entries Sympthia has had in a given period of time, the amount of times it classified those entries as emergency, non-urgent, or mild cases, and the top symptoms in that period. It also lets the user filter with date, province, city, or symptom. Here, we can see an example of the dashboard with data gathered by Sympthia from March 29, 2025 to October 11, 2025 in the province of Ontario. 70 records where we can see the symptoms and where they are located.
A question posed: are there any key societal impacts? Yes. It helps strengthen public health surveillance and response. As an early outbreak detector, the dashboard, which is in real time as it was been explained before, it provides health authorities with clusters of symptoms as they emerge, and which allows for detection of some potential outbreaks days, even weeks before the traditional reporting system. It also reduces strain on emergency by effectively filtering out non-emergency cases from emergency cases, and thereby providing users with a safe home advice, directly reducing overcrowding in the health center. It also increases the health equity, as the system itself provides a free instance and 24/7 access to health guidelines, which is valuable for individuals that are working in remote areas. It also acts as a data-driven policy and planning, which is important for scalability in the health sector in general, as it helps the rich data helps us in predicting and in prescribing future diseases or viruses. We also need to know how relevant it is in the business world. For example, for corporate and enterprise clients, it can act as an employee wellness and a productivity platform, as employers can offer the software as part of their corporate wellness benefits package. Because the main goal is to reduce healthcare costs and minimize lost productivity in the company. Uh, so it's also relevant for healthcare providers like the hospitals, health networks, as the hospitals can also license software and integrate it into their own patient portals, or they can even offer it to their community, as it can act as a triage system, primarily to help operational efficiency by deflecting non-emergency cases from the ER hospitals, and can provide and can reduce overcrowding, decreases patient wait times, and also lower operational costs. It also improves the quality of care for critical patients and it helps the hospital to manage staff burnouts, which directly impacts the hospital's performance metrics. The government can also take advantage of this software, as it can act as a data as a service model. The system itself provides a faster and more cost-effective alternative to the traditional disease surveillance method which has been used in the past. It enables the health officials to detect outbreaks earlier, allocate resources precisely, and also measure the impact of public health campaigns in real time.
But what is behind the scenes? What is on the back end of all of these application? Okay, well, we have here our system architecture is divided in 4 layers. The first layer is the user access, the second one the access layer, the third one the AI layer, and the fourth one the operations layer. On the user access, we have a front end made in Flutter that is going to be used by the user for talking to the agent. In the access layer, we have a cloud function that is going to work for the agent user interaction. So it's going to receive the user messages and is going to send them to the conversational agent, and all the way back is going to receive the messages from the conversational agent and is going to send them to the user. In the AI layer, we have the conversational agent, Sympthia, that is going to understand the context of the user and is going to determine the level of the symptoms of the user, if it's urgent or if it's mild. And in the operations layer, we have another cloud function that is going to receive the data from the agent, is going to process it, is going to clean it, is going to send it to a relational database on BigQuery that is going to keep the records and send the records to the dashboard in Looker Studio. So now, why using AI and cloud? The first reason is because the availability. This is every time available. Our agent doesn't sleep, and we can get the user can get immediate answers about their symptoms at any time. It doesn't matter if it's day or night. The second reason is the scalability, because the cloud allows to handle a sudden surge in users. So it doesn't matter how many users are going to use the app at the same time. It can be just from few hundred to million of users. The app will work every single time. The third reason is the security and compliance and data privacy. The data is going to be encrypted end to end, so the data is going to be 100% secure using GCP. The fourth one is the real-time data analytics, that all the data that the agent is getting from the users is sent to the cloud immediately to BigQuery, and it's processed and visualized on Looker at any time. And the last one is the cost effectiveness. That is really important because using cloud allows you to just pay for the computing and AI that you are actually using. You are not paying for any resource that you are not using. And that's by far more efficient than building and maintaining physical servers like in the past. Okay, all of this is interesting, but what are the next steps? The first one is using machine learning models or AI models to predict the virus propagation. The second one is to implement an AI voice assistant. And the third one is to connect the app to an emergency service. So if Sympthia determines that a patient needs to go to the ER, or determines that a patient really needs help in the moment, the patient can call an ambulance and get help immediately. So thank you.